Hi, Mark Robertson here. I'd like to welcome you to the latest edition of Mark Robertson Talks. Today we're going to talk about healthcare. And in this country, you would think there's two sides to healthcare, the Democrats and the Republicans. But the Democrat side really is not about healthcare. It's about control and power. It's Lenin who said that healthcare is the arch of socialism. The Democrats and the left want to use healthcare to control the people. If you control their healthcare, you control their lives. So it's really not about what works and what doesn't work, or two different opinions on healthcare. It's about one side manipulating healthcare to try to control the public. The answers for healthcare are really very simple. They're like grocery stores. The best way to do it is the free market. But they do all this government involvement to try to control people to think they're trying to help them, but it never works. Government run healthcare is a disaster wherever it's been tried. And the Republicans are weak as well. They just do Democrat light. They really don't have any bold ideas of returning it to the free market. But at least they're not outward socialist and rabid even communist on the issue of healthcare. 2 days that really changed healthcare in this country. First of all, in 1942, April 27th, the disastrous FDR issued wage and price controls. They never work. But that was during the war, and there was a shortage of employees for industries and businesses around the country. So at the same time, another day, the government passed that you could provide health care insurance to employees, and the employees wouldn't have to pay taxes on that insurance as wages. It was just provided, so it was like free to them, essentially. And so this is basically what started businesses involved in healthcare, providing our healthcare. Now, people think that sounds wonderful, but third-party pay is one of the big culprits in why healthcare costs so much these days. People don't know what they're paying. Like I said, I mentioned grocery stores. You go to the grocery store, you know what you're paying for something. You go to the doctor, you might have to pay a copay, but you really don't know what it cost. That is why healthcare costs so much. The main reason, it's not direct pay. It's not like anything else, whether it's government or private health insurance. Insurance should be like auto insurance. I mean, we don't get insurance for oil changes or even tune-ups and things like that. We do get them if we have a wreck for catastrophic. That's what a health insurance should be. It should be catastrophic, and we should pay for it directly, either savings accounts, health savings accounts, or some other way. I remember going to a doctor as a young child. My mom would go into Dr. Dumont's office, and she'd pay him cash. I mean, it was not much, $5 a visit or something like that, and he'd check a number of us kids in our family and my mom, and so that's how it was until then Medicare and Medicaid came along in the mid-'60s and made things even worse and really harmed healthcare. Healthcare was largely provided for by churches. Many of the hospitals were churches, and charities took care of the poor and things like that. Now we've got into Medicaid, Medicare. It's really gummed up the works. It's distorted prices. It doesn't work. It makes things worse. It's out of control cost, and it's just a mess. And it all happened because government involvement in healthcare. And like I say, those 2 days in the 1940s basically got us away from the free market healthcare. And we get into that third party pay. If you don't know what you're paying, doesn't matter. And it's got to be like anything else. And so we basically evolved from there, and all these other things that have gone along with getting government involved. Most of it has been to solve the problems that government involvement has brought about. And it's the reason for higher healthcare cost. Like I say, if we knew what we were directly paying, it wouldn't be so expensive. We could shop around. They say, well, you can't shop around for healthcare. People are sick. That's crazy. People shop around for everything else, so you can shop around for healthcare and what the prices are. We got to get back to that. We got to get back to direct pay. We got to get the free market more involved in healthcare. Like I said, health savings accounts and private charity. Private charity is the answer to the poor, not Medicaid. Look at all these places, all these hospitals like Danny Thomas's hospital in Memphis, St. Jude. It's all charity. It's run privately, and they do a great job private charity would take care of the poor. We don't need this Medicaid, which costs now $700 billion a year. It's broke, and more doctors aren't even taking Medicaid patients. So where does all that money go? It's like Milton Friedman has often explained with Gammon's law. Gammons was a doctor in England. He studied the British Health Service. He said the costs keep rising, but this British Health Service keeps getting more and more inferior. Where does this money go? Well, when you pour money into it, the bureaucracy expands. It doesn't go to the patients. It goes to the bureaucracy, and they come up with reasons that they need more people to do this and push more paper. And all this paperwork that these doctors have to do now because of Medicare and Medicaid, it just throws it out of sync. Plus, it puts all these restrictions on doctors. They got to follow all these rules in order to get paid for this or that. You got bureaucrats telling doctors how to do their job, how to practice medicine. It's crazy. Medicare, Medicaid have been disasters, and the government involvement there, and it's breaking the economy, it's breaking the states, it doesn't work. There are many studies showing that the poor are better off without Medicare, or Medicaid, excuse me, and they had better results. The poor were better off before Medicaid, as many studies show. Thomas Woods has done studies on this. He does a lot of work in his book, The Politically Incorrect Guide to American History. He covers that. But the poor had similar hospital stays and doctor visits to other brackets of wealth and before Medicaid came about. So they were better taken care of before Medicaid. It's really a disaster. It gets in the way of doctors doing their job. It gets in the way of doctors providing free pro bono services. And all these regulations they got to go through, it's not worth it. So it's really bad. The federal government should not be involved in healthcare at all. Shouldn't be involved in education. It's the same way. All this spending on education, where does the money go? High spending per pupil in these cities. They still can't read, write, or do math. So it's like everything else. The government involvement just messes everything up. And like I say, Medicare and Medicaid are reasons for high prices as well. When you don't have market forces pushing the prices down, it doesn't matter what. There's no accountability. This is why I say Medicare, Medicaid cost over $1 trillion combined, as soon to be $1 trillion individually. Yet more and more doctors aren't taking Medicare and Medicaid patients because of inferior reimbursements. So the money gets eaten up by the bureaucracy, like we were saying. And these restrictions on doctors, that Dr. Newman I was talking about, he basically got out of practicing medicine in his mid-60s. I mean, you can retire then, but he said it was the paperwork and all the regulations put onto them by Medicare. He was a great doctor, but the government basically kicked out a good doctor right there. And all these other regulations that go really, government regulations harm healthcare. They hurt healthcare. And these socialized countries, it's really a disaster as well. And that seems like what we're heading towards. Socialism, it's never worked, never has worked. Socialized healthcare is a disaster wherever it's tried. I mentioned in Great Britain, there are over 4 million people on various waiting lists for various medical procedures or to see doctors or whatever. It's basically in meltdown mode over there. The British national healthcare has never worked. It's been a disaster from the beginning. And it's the lies put forth. These countries are moving towards the private sector because these government healthcare systems are total failure. The same in Canada. The waiting time in Canada from the time a primary care physician sends you to a specialist was over 4 months, and that was a number of years ago. It's actually increased since then. The Fraser Institute in Canada does a annual survey of waiting times and all the problems with the national health care in Canada. As a matter of fact, essentially the founder of the national health care in Canada, I believe his name is Claude Gastinet, now says it was a major mistake. Canada should have never gone in that direction. It never works. Government health care never works. It's a disaster. We need to get back to a very simple plan of doctors having their offices, putting their shingle out, and going in. You pay directly, and it's the best way to do it. Even all this corporate doctors, things like this, that's largely because of government involvement, because they can manipulate all the money from government coming their way. That's largely what Medicare and Medicaid is about. It's a cash cow for all these hospitals, and they basically have a false economy. They run their hospitals knowing that they're going to get all these hundreds of millions or billions of dollars throughout the country for these hospitals. And then they say they're out of money because they have to hire all these new people, things like this. Not that healthcare doesn't cost, but you've got to get back to the free market and private charity. That's the only answer. Government involvement has been a disaster, and it's predictable. I mean, it always is. And like I say, churches I was born at Sisters Hospital in St. Joseph, run by the Catholic Church. I remember these nuns, they had these pointed habits, and they were the nurses largely, and the doctors were there. Not that it's totally ideal, there's problems, but that's what healthcare is. The government should not be involved in healthcare at all. It's brought so many problems to it, and it's always cost more than it's predicted. Lyndon Johnson predicted that Medicare would cost $9 billion by 1990, passed it in 1965 or 6, and it actually costs $65 billion now. And like I said, it's around $700 billion and continuing to spiral out of control. And it's what it is. There's no market forces to bring it down. There's so much fraud, waste, and abuse in it as well. And it's just out of control. It never works. And plus, seniors have Medicare, but the last I checked, they all have to get supplemental insurance, and they all have to pay a lot out of their own pocket. So it's crazy. It's like not even having it. It's all a scam. Medicare and Medicaid are scams. They don't help people. We'd be better off without them. I mean, direct pay would keep the prices down. And it has to basically be phased out, Medicare and Medicaid, in favor of health savings accounts where people can put money into their health savings account and it grows over time, and they can use this to direct pay, and each of them has catastrophic insurance as well. That's how we have to turn to it. The free market is the only answer for healthcare, and private charity as well. But this Medicare and Medicaid are out of control. They've got to be phased out. They're broke. Along with Social Security, the unfunded liability is well over $100 trillion. We don't have that money. That money isn't around, and it's breaking us. And the healthcare is inferior. It's like all socialized healthcare. Costs surge out of control, but service deteriorates. It's so predictable, and it happens all the time. And the government always thinks they know best. They don't know best at all. These guys are just bureaucrats. It's all about control. It's all about power and control. And they want to control our lives and think, oh, well, they'll elect us to office, we'll provide them for free health care. Well, nothing is free. Somebody's paying for it. And as PJ O'Rourke said, you think health care is expensive now, wait till it's free. And it just keeps costing more and more. You have to have free market forces in there. You have to have choice, direct choice, and people have to be able to see what they're paying for. And there's a book called Patient Power, and the patients have to be in charge, not the government, and they have to be able to make the decisions. And that's the only direction we can head. It's like I say, it's not worked anywhere, government health care. And I remember Dr. Dumont, like I said, from what I understand, I was born in the 50s, and my birth cost my dad $75, and he paid cash for it. And so that's the way you got to go. You're going to have to pay cash. I know people like things free, but employers in providing health insurance, we're eventually going to have to phase out of that as well. I know there'll be some crying and moaning, but it actually costs more anyway. I mean, these businesses, they think, well, they're getting free health care. Well, they're actually just getting less pay. That's what's paying for it. And it's going out of control too. People are having to pay more and more. Obamacare really surged the cost of health care. It was promised that they would reduce premiums by $2,500. Of course, that was a lie. Anytime government gets involved, it's going to cost more. And there's not anybody less uninsured. There's still over 30 million people uninsured. As they said, that was why they had to bring about Obamacare. Now they want Medicare for all, which would essentially be the end of the healthcare in this country. It would be such a disaster. It basically would bankrupt the country. These people, they are just nothing short of evil. Their ideas don't work. Medicare for all would bring so much misery and harm. It would destroy our healthcare system. Look at the VA. It's been a disaster. Yes, President Trump has done some things to improve it, but still the basic foundation, the basic model is not good. Government healthcare does not work. It never has, and it never will. It can't work. It's by design. It can't work. And single payer, people think, oh, well, there's less bureaucracy. That's just total nonsense. It's total bureaucracy, and it's out of control. It doesn't work. It's such a disaster in Great Britain and Canada. It doesn't work anywhere. There's waiting list to beyond waiting list in Great Britain from the last I checked. And like I said, there's over 4 million people on these waiting lists. And it's such a mess and such a disaster. And they often think healthcare is a right. It's not a right. It can't be a right because somebody is paying for it. So it's not a right for the people paying for it. So healthcare cannot be a right. But ironically, the few countries left that have some semblance of free market, they provide healthcare as better than the socialized countries anyway. That's supposedly treated as a right. And there's still very much inequality in healthcare in those socialized countries anyway. It's such a lie, and there's so much distortion and so much waste and so much corruption. And these doctors are basically government workers. They don't like that. They're not motivated. Not that they should be free market, profit motive. The profit motive keeps prices down, but nobody gets into the healthcare business to make a huge profit. But profit is part of it, and it should be run as a free market. That's the best way to keep your healthcare system going. And so healthcare has been messed up in this country by government. Government is the problem. It has created all the problems, nearly all the problems. And of course, we got to take better care of ourselves too. There's things you can do. I've been reading these books by Anthony Williams, Medical Medium, and he's way ahead of the healthcare system. We rely too much on it to take care of our health. But Anthony Williams basically says you got to get the liver cleaned up, and that's going to help your health. And I've been kind of following his books and highly recommend them. And so we can do things on our own to improve our health. There's a lot of things that we can take care of. We can't rely on the medical system for all of our problems. We got to be proactive and take care of our own health. And like I say, I recommend you check out Anthony Williams. He's very good, and he can help you improve your health. He's helped my health immensely. And but I paid for a book there. I don't know him. I've never met him, but I learned a lot about him. He's not even a doctor. He's got some good ideas on health, and very simple. He's not trying to make money. It's very simple, and he's got some good ideas. But that's the answer to healthcare as well. Take care of our health. We got to take care of our health, and nothing wrong with working out, things like that, and working on diet is part of it as well. We can't just totally rely on these drugs, the drug manufacturers. That's another thing. The pharmaceuticals, yes, they make profits. You hear about these outrageous prices for various things or various drugs. Well, that's because somebody will pay for it. So if the government's going to pay for that, or an insurance company will pay that, that's why they cost so much. But if it was actually free market, people wouldn't pay that because they can't afford it. But the free market actually, the going against the free market or third party pay also is a major reason that pharmaceuticals cost so much as well. You got to get the free market back there too. And but we've got Medicare paying for prescription drugs and all this other stuff, all this bureaucracy. It just totally distorts the market, totally distorts prices, whether it's actually in doctor care, hospitals, or pharmaceuticals. We got to get back to the free market and private charity. And yes, most pharmaceutical companies do have programs for those who can't afford their prescriptions. But nonetheless, we got to get it so these costs come down. And, generic drugs are a good answer, but and they say, well, get them from Canada. Well, Canada doesn't do hardly any investigation or any research into providing new drugs because they can't. That's the free market. It costs these days about $1 billion to bring a drug to market, counting all the ones that fail. And so there's so many regulations by the FDA and things like this that get in the way as well. These government agencies, supposedly to help the healthcare system, often get in the way. Not that there doesn't have to be any oversight and things like that, but often it does more harm than good, and the government bureaucracy there hurts things as well. So in case you haven't noticed, my main gripe in healthcare is government involvement. Healthcare was much better off before the government got involved. You go in, you pay directly the doctor, you pay hospitals, you have catastrophic coverage in insurance, which is what insurance is. It's not even insurance. You get these pre-existing conditions, these people claiming about these insurance companies should provide for pre-existing conditions. That makes them not insurance companies. That's not what insurance is. Now, before Obamacare, nearly every state had situations or programs where they covered pre-existing conditions, but Obamacare wiped them out. Obamacare was a scam. It's all about control. Obama was an Alinskyite, still is, and he wants to get power and control. Even they said they had to rely on the stupidity of the American people to get that passed. Google Jonathan Gruber, and he's an MIT professor. He's one of the architects of the Obamacare catastrophe. And he basically says we had to rely on the stupidity of the American people, and a lack of transparency was a great advantage of getting it passed. So it was a total lie getting it passed. The great Dr. Ben Carson says Obamacare is the worst thing to hit this country since slavery. And he's a world-renowned neurosurgeon, and he knows it's true. Obamacare has been a disaster. It doesn't help anybody. There's still over 30 million people unemployed. The deductibles have gone out of sight. Many people, middle class so-called, can't even afford health care because the deductibles are so high. And so it's basically distorted so much. It's been a disaster. Thankfully, we aren't forced to have it anymore. President Trump got that done. Hopefully, Obamacare can be totally wiped off the map, and they'll return to free market healthcare. And there are a lot of ways to do that. But it seems that most people who want to fix healthcare, even from the conservative side, they look and say, well, here's how we got to improve Medicaid. Here's how we got to improve Medicare. No, that's not my answer. My answer is to phase them out in favor of the free market. And that's the only way to go, in my opinion. There's a lot of books on this that I recommend. And a couple of them one of them is Lives at Risk. And it's by John Goodman, Gerald Musgrave, and Devon Herrick, with a foreword by Milton Friedman. So it's a good book. This book talks about socialized healthcare systems around the world and what a disaster they are, and how many of them are turning more towards the free market. It's their only choice. It's been a total disaster. Government healthcare never works. It never has worked. It won't work here. It's bankrupting the United States right now. About over half the healthcare in this country is socialized, which is what the reason for all the problems are. And so I recommend that book. It's very good. It tells you about those systems. Here's another book. It's an older book. It's called Cold Blue. It's by a Dr. Edward Annis, A-N-N-I-S, and he's a medical doctor. Very good common sense answers in this book to our problems. And they highly recommend that. He says basically a lot what I said. It's the government involvement in healthcare has been the major problem. Here's a good one too, Overcharged. Now, I don't agree with everything they say in that book, because a lot of things they want to do, like I said, are just to reform Medicare and Medicaid. But they do present good reasons why we pay so much for healthcare. Healthcare should be like anything else. It should be like going to the grocery store. It should be like doing anything else. Prices should be set by the free market. And right now, it's so out of control, and so much bureaucracy, so much fraud, so much waste, so many lies. Healthcare is just largely not even about healthcare. It's about control and power, and it's just drifting in the wind, actually, a lot. And some people say that healthcare is too important to leave to the free market. Well, in my opinion, healthcare is too important not to leave to the free market and to private charity. And that's the way we got to go, or it's going to continue to spiral out of control, and we're going to continue to spiral toward socialized healthcare, which we're already there halfway at least. And it would be such a catastrophe for this country. We're already 22 trillion in debt, would be much more in debt. And it's laughable. All these states expanding Medicaid, it's going to be a disaster. It's going to cost much more than they project. It's not going to work. It's not going to automatically be nirvana for all these people that supposedly don't have health care coverage. They'll be back very shortly asking for more money, because that money goes into the bureaucracy. It's not going to help anyone, and it's going to be a disaster. And it's not going to work. So basically, you catch my drift. We got to get government out of healthcare. And I thank you for joining us again today on Mark Robertson Talks, and we will see you next time.